You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. Also, quick disclaimer. The opinions shared by our guests are their own and don't necessarily reflect the views of Otis MotherToBaby. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a MotherToBaby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the MotherToBaby Podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people, patients, family members, healthcare providers, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication you take, it could be a chemical at your job, a condition that you have, even sometimes the things that we eat and drink. Here to talk with us today about some of those exposures are returning guests, Angela Messer and Kirstie Perrotta. Welcome back to the show.
Thank you.
Thank you to be here.
So both of you have been on the show before. Thank you so much for coming back. Can you remind our audience a little bit about your backgrounds?
I'm Kirstie Perrotta. I am with the MotherToBaby California service. I'm one of our teratogen information specialists there. I also currently serve on our board of directors and oversee our CDC cooperative agreement. And I am a mom of two boys. They are 4 and 7 now.
And I'm Angela Messer. I've been with MotherToBaby for 16 years now. And I am the chat coordinator for a counseling service. I serve on a couple of the committees here at MotherToBaby, and I'm a proud mother of a 6.5-year-old daughter.
Awesome. So let's jump right in. What people call guilty pleasures, I'm just going to say pleasures, right? Let's just take the guilty right out of it. But thinking about things like coffee, sushi, soft cheese, thinking about pregnancy, what do people ask? What do people think? What do they get right? What do they get wrong? Debunk some myths for us.
Sure. So let's start with coffee. I am a big coffee drinker personally.
Woo!
So when I found out I was pregnant, that was one of my first questions. Had to go check our fact sheet to make sure I was up to date. But typically about 200 milligrams per day or less is what is suggested by most experts. So you can have that occasional cup of coffee, cup of tea. You just want to kind of make sure you're keeping track of everything you are consuming throughout the day and not going over 200 milligrams.
I'll talk about cheese because I am a cheese person. And yes, a lot of people still believe that you can't eat soft cheeses, a lot of the specialty cheeses, but really making sure it's pasteurized. That kills off that bacteria that, that can cause that concern or that increased risk of foodborne illness. So pasteurization is the key, making sure it's pasteurized. Most grocery stores, the cheese is pasteurized, but always get a double check.
Okay, so labels like raw milk, raw cheese, is that the kind of thing that it's suggested to avoid?
Yeah, yes, because that can, could possibly have that bacteria that can cause these foodborne illnesses that we know is a real concern during pregnancy. So really making sure avoid raw ingredients, pasteurization of those milk, especially with things like going to farmers markets. That's really important. A lot of people, I love a good farmers market.
Sure.
I love a good farmers market, but yes, definitely check those food ingredients and make sure they're not pasteurized. Probably not a good idea.
And Kirstie, I am a coffee person as well, absolutely. But I got lucky, if you will, when I got pregnant with my last two. I couldn't stand the smell of coffee. Where I was headed was sushi. Mm-hmm. And that was the thing where I needed to run and be like, what can I do? What can I do? So can you talk to us about that?
Yeah, so there's typically two things I think about when people ask about sushi. So one is the food safety aspect, which Angela just touched on. So making sure that things are cooked appropriately, heated appropriately, to make sure to kill off any of that bacteria that could be present. And then the second issue, of course, is methyl mercury. So that can be found in certain types of fish. So again, just thinking about your total consumption and making sure that you're not getting too much of that, because methyl mercury can be a concern in pregnancy.
Got it. So it's more of a balanced diet, right? Making sure you have good tabs on what you're taking, of course, intaking your water, taking your prenatal vitamins. So it's not like it's off limits, but it's more about the amount.
Right, the amount, and then just making sure you're choosing the right types as well.
Okay, so unfortunately, cold and allergy season kind of seems to be never ending now. I remember when I was a kid, allergies were pretty much in the spring, but I'm not on the East Coast anymore. Thinking about those things like, cough drops, antihistamines, decongestants, what is okay to take in pregnancy and breastfeeding?
So here at MotherToBaby, of course, we can't make recommendations, but we can kind of talk to people about, general concepts. And one of those that we frequently mention is the preference for topicals in pregnancy and lactation. And what I mean by a topical could be something like a Vicks vapor rub, right? You're applying it to the chest, and generally the skin's going to serve as a good barrier, so we don't expect that it's entering into your system, crossing the placenta, and reaching the developing baby. So that provides a good amount of reassurance. But also by topical, what we could mean is something like a nasal spray, for example. That's designed to work very locally, to help with that congestion in the nose. So kind of the same idea. We don't really expect that it's getting into the blood and reaching the baby in significant amounts.
And, sometimes those topical medications or topical products don't work for everybody, right?
Sure.
We get calls from people that say, I've tried the nasal spray, I've tried the topical, and I'm still, having trouble, I'm still miserable. So there are oral medications out there, other treatments that are available that have not shown to increase the risk for things like birth defects or pregnancy complications. And calling MotherToBaby, we can definitely go over those with people.
Yeah, and it's a cool thing too, right? Because, even though we certainly don't make recommendations, sometimes your healthcare provider has a list of medications that they would prefer that you use, so you can always start with them. But if you have something that you've used, something in your cabinet, it's like, oh, I used to take XYZ, now that I'm pregnant or breastfeeding, can I still do it? That is the perfect time to call MotherToBaby, because even though we can't make recommendations, we can certainly look up the information and let you know what the profile is, the information that we have.
Exactly.
Something else to keep in mind, I feel like a lot of people prior to pregnancy will often use multi-symptom products, right? So that Dayquil, that NyQuil, it takes care of everything. So why not just, try to knock it all out? But in pregnancy, of course, it's really important that we're trying to limit the ingredients that were used, right? So if you're going to take something, we want to make sure it's effective for you, that it's actually targeting, a condition. So if you have a fever, but you don't have a runny nose, then maybe you just stick with the acetaminophen to treat that fever, as opposed to taking some sort of decongestant to help with the nasal congestion. So just something else to keep in mind.
Right. I love that reminder, because people very often don't want to take more of anything that they need. So it's important to treat those symptoms, those exact symptoms, straight away. Mm-hmm. Excellent point.
Just a good reminder to look at the label too, because a lot of people don't realize something is a multi-symptom. They just see the brand name or I think it's one ingredient. So always good to look at the labels, and we can talk about those ingredients with you.
Absolutely. And, for breastfeeding, it's similar in that, of course, you're going to want to know, is that the kind of thing that I can take during breastfeeding? Your provider or your baby's pediatrician might have a list of products they prefer, but also not to forget, especially, in the time of COVID and stuff like that, to remember the good hand washing techniques, cover your mouth. Breastfeeding has all of these benefits. So if that's the way you're feeding your baby, that's still okay when you're sick for the most part, but it's important to practice that good hygiene and, don't do what I did and sneeze on your poor baby
It happens.
when you're getting sick. It does. It does.
We all have.
If it can be avoided, that's probably going to be a bit more helpful.
Absolutely.
Definitely.
So thinking about, cold, flu, germs, COVID, all these things, let's talk about cleaning products, things like bleach, ammonia. Is there something that we should avoid? What should we be doing to minimize the exposure during pregnancy and breastfeeding?
It's a good point. We get a lot of those questions quite a bit about, I use a wipe, or I wipe this down and I touched it, and is my baby going to be okay? And we understand the concerns. Really, it's about, like you mentioned, minimizing exposures when you can, but using things as directed, making sure you have good ventilation. If you're using a cleaning product, make sure windows are open. sometimes the smell is just bothersome in pregnancy, and you can wear gloves and a mask if you're really concerned. Minimize as much as you can, but we're using them as directed. There's not likely a concern.
Yeah, and I appreciate the smell thing, right? Because I was very sensitive to smells. Some people are. And that doesn't necessarily mean that anything is wrong or that you've, inhaled too much or that it's going to hurt anybody. But it may be uncomfortable. So feel free, crank open that window, crank up that fan, walk outside if you can. Not in Arizona, it's triple digits.
Yeah.
But try and get some of that fresh air in case you feel, headachy, dizzy, nauseous, things like that.
Right.
Kirstie, what about bleach and ammonia?
Good question. So the most important thing to keep in mind with those two is that we do not want to mix them. We get calls about that every once in a while. So really important not to use those two together. And I know that can be hard to remember because when you're cleaning, you have, all the different bottles out and you're tackling different surfaces, but those two definitely should not be combined.
Absolutely. And, sometimes right before delivery or really at any point in pregnancy, right? You're trying to get the space ready for baby. And thinking about, all this cleaning stuff, this comes up a lot. It's not just, the spring cleaning thing. I think that, folks get into nesting and they get really, interested in preparing for baby as you would expect. And so it's good to know, take it easy. First of all, you don't need to clean all the time, or maybe you can have somebody else help you with the cleaning, but it is something, that folks do all the time. It's an everyday exposure. Using the cleaning products as directed, we're typically not worried. Is that a fair statement?
Yeah,
definitely.
So as often as I suggest that people don't do it themselves, I am absolutely guilty of going to Dr. Google and trying to Google my symptoms, Google stuff in pregnancy. And of course, social media is a lot. There's a lot of information. There's a lot of advice. What's the craziest thing you've seen on social media related to pregnancy or breastfeeding? And how do you filter through the information? How do you know what's reliable and what might not be so much?
So one thing I know I've been seeing a lot online is just various supplements to treat all sorts of different conditions. So we have vitamin C and elderberry for the common cold. Vitamin A is back in the news with measles, being a problem again. And I think the thing we have to remember about these supplements is that they are not well studied in pregnancy or lactation. So we often don't have the data that tells us how they could affect the developing baby or the breastfed infant. They're also not well regulated by the FDA, so it's really difficult to know what's actually in the supplement. No one's really checking, to make sure that what's on the label is actually what's contained in the supplement. So really a lot of unknowns. And I know people, sometimes prefer the natural route, but when there's no data and a lack of regulation, it's often not the safer choice.
Absolutely. And I'm so glad that you mentioned the idea of natural, right? Because we hear that all the time. It's like, oh, if it was, a root or a plant or a tree, then obviously it's better than a medication that's not. And that's not always a one-to-one. And it's not just the safety. The other thing is, does it work? Right? Is it something worth taking? Do we know that it works? And again, because these things are very typically not well studied in pregnancy or breastfeeding. I believe, typically what we say at MotherToBaby is, check with your provider, of course, and you always have MotherToBaby to come to also. But typically you want to steer away from some products, some supplements, some herbals, but it's such an individual thing, right? It's not a one size fits all.
Always weighing the risk versus benefit. Ultimately, the decision's up to the mom, right? She can do what she feels most comfortable with, but of course, we're going to talk about the lack of data, the lack of regulation, and then also possibly mention some proven, techniques that can help people avoid illness. So good hand washing, very basic, but it works. Staying up to date with vaccinations, avoiding sick people, things like that are really kind of your best bet during respiratory virus season.
Angela, what are you seeing out there?
Well, speaking of supplements, folic acid is something I always see out there on social media. Really folate, different forms of folate. So folic acid is the proven one that's been studied in pregnancy, has been proven to help reduce the chance of certain birth defects like spina bifida. So it's really important to make sure you're getting the folic acid. That's synthetic form of folate, and people often saying, that's not, true a version of what I want, or the natural, like Kirstie was saying, but it's really folic acid. That's the one that you want to make sure, 600 to 800 micrograms at least. And that's what typically will be in a prenatal vitamin that you'll take during pregnancy.
Absolutely. And that can be hard to remember, right? There's already so much going on, never mind in the world, but pregnancy and your life and stuff like that. Fortunately, MotherToBaby has a lot of resources about folic acid use in pregnancy, multiple podcast episodes. We have a fact sheet. So make sure that if it's any point of confusion, to use our excellent resources and, always talk with your healthcare provider.
Yeah, I love our blog on the prenatal vitamins, because we have so many people that come to our chat and, they'll send me 10 different links and say, which is the best prenatal vitamin? And so I'm clicking through all of them. But there's so many things we have to look at. So we're looking at the folic acid, but we're also looking at the vitamin content. We don't want to have it be too high. We don't want 1,000% of the daily value, but we also don't want it too low, because those vitamins are really important. We don't want, herbal components added for the most part, because again, those are not well studied. So it's really important to check that label and just make sure that you're getting what you need.
And we also get that from our diet, right? So we get their vitamins and nutrients from diet, really important. So you don't want to do too much of something in a prenatal vitamins and you're really overdoing it with everything. So really important to check. And call us if you need to have any questions about those.
Excellent. And so I know that each of you have been pregnant. And so was there something in your pregnancies that you were really worried about, like an exposure? And what would you tell your past selves now, knowing everything that you know?
Yes. There's some things you get really nervous about during pregnancy. I was eating my salads and trying to get all my leafy greens and be very healthy. And there was a listeria outbreak that was in the news. And of course I got really nervous, but everything was fine. I just avoided that type of lettuce, and I just, use other vegetables and other healthy options. But yes, those things that pop up in the news, it's good to be aware of. Again, calling us if you have concerns too, but that was something that was kind of a little nerve-wracking when I had that. So
absolutely. So Angela, knowing what you know now, what would you tell your younger self?
Oh, yeah, just not to worry so much. I mean, the one time I had that, it's very unlikely and it wasn't a concern. It ended up being fine. Right. So just really, do the best you can. We all do during pregnancy. Avoid what you can, but it's really tough. You can't, avoid everything all the time. Yeah. So, just try not to worry as much. And if you really need some more reassurance or just, want to talk to someone about it, always contact us or your provider.
Absolutely. Kirstie, how about you?
Well, one thing that comes to mind is in the first few weeks of my first pregnancy, my husband came down with shingles. And shingles is highly contagious. So if you have not had chickenpox or not had the vaccine, then you can catch it. So I, kind of went overboard. I moved out of our apartment, went and stayed with my parents for a couple of days, and then, probably more than I should have, a couple extra days. And then when I came back, I remember washing everything and cleaning the counters and, back to the cleaning products. I had gloves on, I had the windows open, but just went a little overboard. And so I think, in retrospect, I probably could have calmed down a bit because I was vaccinated, and vaccination provides a great amount of protection, and I probably would have been fine. But at the same time, I think, if you're anxious about something, it's okay to take that conservative approach, right? So, we get calls from people that are anxious about toxoplasmosis and they don't want to change the cat's litter box. And if you have a partner who's available, make him do it,
or someone else.
9 short months, right? Or cleaning products, right? If you are concerned about the different chemicals that you're using, maybe don't clean that day, right? Or again, if you have someone else that can help you do it, that's always a great option. So I think, everyone has a different risk tolerance. And I think if you want to be more conservative and that helps decrease your anxiety and makes you feel better in the long run, I think that's appropriate.
Mm-hmm. I would agree. And thinking about my pregnancies, one of the things actually after pregnancy was breastfeeding. And it was something that I tried multiple times and was not terribly successful at. And what I would tell my younger self is fed is best. You're doing your best.
Yep.
Feed your baby.
Yep.
That's it. Because there's so much pressure. Like I think about the food, right? It's like, there's so many do's and don'ts in pregnancy, and it's already really, really challenging, but you are doing your best no matter what. And that is appreciated. And we see you, and you all have done your best, and thank you for the work that you continue to do. We cannot say how important Mother2Baby is and how helpful it is to have somebody listen.
Yeah, sometimes it just takes that. I mean, someone to talk everything through. Yeah. We know that sometimes, time is limited at the doctor's office, and they're so important, and providers are obviously there for you, but we're here for you too.
That's right. And we're experts, right? And your provider is an expert in what they're an expert in. Mm-hmm. And this just happens to be what we're experts in.
Yeah.
Right. So we are always here. Thank you, Kirstie and Angela. I cannot wait to have you back on another episode if the two of you are willing, but
Yes.
always great information. And again, keep up the good work at Mother2Baby.
Thank you.
Thank you so much for having us.
Yes.
And that's going to do it for this episode of the Mother2Baby podcast. Be sure to hit that subscribe button so that way you never miss a new episode. You can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. If you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contact@mothertobaby.org. And Mother2Baby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit us on our website, mothertobaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the Mother2Baby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Mother2Baby would like to take a moment to thank our very generous donors who help support the important work that Mother2Baby does. Jason Alexander, Emily Gravelet, Chad Haldeman Englert, Lori Harris Sagatabai, Jamie Hung, Beth Kiernan, Kendra Kramer, Nevina Christic, Ruth Moss Katznelson, Sarah Obachan, Kirstie Perrotta, Alfred N. Romeo, Anna L. Taylor, and Elizabeth Wasternack. Thank you all for your generous support. And if you're interested in becoming a donor, be sure to visit our website at mothertobaby.org. Until next time, remember, Mother2Baby is here for you. Take care.
Mother2Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother2Baby, please visit mothertobaby.org.